You're listening to Health Professional Radio with Wayne Buckler. My guest today is Milena Katz, who's an accredited practicing dietitian. Now, Milena joins us from Sydney. And first of all, Milena, welcome to the program.
Thanks, Wayne.
Can you tell us what an accredited practicing dietitian is?
Well, an accredited practicing dietitian is a clinician that has been trained for at least 4 years, sometimes 5 if they have a Master's of Nutrition and Dietetics, or at least an Advanced Science Bachelor of Science Honours. And they are allowed to work in the hospital system or in private practice and provide medical nutrition advice or actually prescribe medical nutrition therapy, such as a complete nasogastric feed or a PEG feed, or provide guidelines around how many calories or how much protein and other macronutrients a person needs. So it's quite advanced in terms of what we do, and it has a lot of obviously clinical ramifications. So we deal with the well, but also with the very unwell.
And Milena, are you a private clinician yourself? Are you in private practice, or are you working in a facility?
I've been an accredited practicing dietitian for 13 years.
Right.
And in that time, I've done a variety of things. And currently, I work as a nutrition consultant, and I work in aged care facilities and also in a private practice, seeing clients face-to-face and also doing aged care work around facility nutrition and the menus, as well as providing individual advice to the residents and doing in-services to staff. And I write for publications and do a lot of speaking engagements on a variety of topics. I'm a mum of 2, so I don't have as much time as I did before, but I really enjoy my work because it's very satisfying to see people feel better when they implement changes, or the facility will implement changes for a particular resident.
Milena, most of our audience are clinicians working either in acute care or in aged care. What's the takeaway message for them today? What would you like them to know?
I guess I'd like them to know to think about a person's nutrition as being something that's actually very important, almost as important as their falls risk, potentially, something that should be at the top of people's minds, and to include the dietitian that's working with them a bit more, and to get nutrition prioritised, because we know that a lot of patients and clients are malnourished in the aged care space, and obviously that doesn't bode well for their long-term discharge or bouncing back into the health system. And there is a lot that can be done on with small changes, where it's with the family or with the facility, or just changing things. But also that accredited practicing dietitians are quite well versed in the clinical space. So we've been trained, we know the intricacies, but we also have very good interpersonal skills in dealing with a family and with a client, because basically we talk all the time. We talk about the client, our intervention's not physical like a physiotherapist or a speech pathologist. We actually are talking to people all day long, and we spend quite a bit of time with clients to find out what their individual likes, dislikes, and what they actually can eat and can't eat. And so, we want other clinicians to trust us and to engage us in, teleconferencing, but also in case conferences, and to put nutrition first, because it is a real big issue, especially in the aged care population.
I can certainly understand that. In every occupation, Milena, there are misconceptions. What's the biggest misconceptions amongst your colleagues, clients, customers, patients? What's the biggest misconception about your work as an accredited practicing dietitian that drives you nuts and keeps you awake at night?
Oh, there's lots of these things at the moment. There's a lot of celebrity pseudo-nutritionists out there who are peddling a particular message, and we have guidelines that are the Australian Healthy Eating Guidelines. There's a lot of research that gets done. We take a very much an evidence-based approach. So just because protein or low sugar or anything else is popular now doesn't mean that that's actually evidence-based. We'll look at the whole picture, and we don't prescribe diets. So we're not out there peddling a diet, which a lot of people in the celebrity and media space are because they have a buck to make out of it.
Yes.
We're not allowed to use even testimonials. The Dietitians Association's Code of Conduct prohibits us from using testimonials. So you won't see us running around talking ourselves up, and we always look at the individual's particular medical history, their needs, what they like and dislike, and of course there's the medico-legal issues around taking somebody on as a patient and providing them with advice, because it all goes into their, medical history and record. So we are, I guess, just like any other doctor or allied health professional in that sense. But because we deal with a popular topic of food, it has become sensationalized in many ways. And, of course, everybody eats. So everybody thinks that they have something to say about it, which they do. But because the adverse effects of a diet are not felt for many months down the track, it seems that, everybody, I guess, is entitled to write up a diet and to sell it as being something that has changed their lives around. And any diet is obviously going to, most people will lose weight from any kind of diet, whether it's grapefruit or all meat or any other diet, because there's a change that happens. What you never see is what happens to these people a year down the track, because they always rebound in weight. They always go back to their old habits. And we're in the business of, I guess, making the mundane more palatable, because we know what works. There's variations that will suit different people. So some people do slightly better on a high-protein diet. Others do a little bit better on a higher fiber, higher complex carbohydrate diet. It's totally variable. It depends on what stage of life a person is at. Let's not even talk about children. So it's completely individual. And, we are not in the business of prescribing diets. We will guide people along the path of healthy eating, and that looks totally different for most people. So it depends on their genetic makeup and also, what their cultural preferences are. And so, we are in the same space as most other clinicians. We just deal with the food side of things.
Milena, it's been lovely to chat with you today. My guest has been Milena Katz, an accredited practising dietitian from Sydney. And with a little bit of luck, we'll help dispel some of that misconception, Milena, with our audience today. Thank you for your time.
Thanks, Wayne.
If you just missed my chat with Milena, the good news is we've got a transcript on our website at www.hpr.fm, and you can also find links to the audio archive on SoundCloud and on YouTube, where you can hear the full interview again. This is Health Professional Radio. My name is Wayne Buckler.